Oh, hello. Hi, I'm trichologist Lisa Akbari, your hair doctor. And today I'm super excited about the show, as I am with all my shows. You guys know me. I get so excited because I think this is a great opportunity to be here to help you and to bless you. I get tons of emails all the time, and sometimes I'll look inside my email and I will say, okay, you know what? I need to do a show. I feel like I got a gold spot right in the middle of my. I need to do a show from my email box, and that's what I did. Today we're going to talk about hair loss. We're going to talk about hair loss, ACell treatments, PRP treatments, and hair transplants. So get ready, get ready, get ready. So if you're just, I see you guys are logging in. So we want to make sure that we welcome you to the show. So welcome to the show. I'm trichologist Lisa Akbari, your hair doctor. And for the next 60 minutes, I will be your hair doctor answering your questions. And as I said today, I'm going in my email box. We're going to talk about ACell treatments, PRP treatments, hair transplants. I had a patient, well, actually a viewer, to send me an email, and she wanted to know about this hair loss. I mean, she's having some problems. So we're going to kind of talk from her email, and then we're going to look at these treatments. We're going to look at some research and what's out there. And then we're going to look at actually what we have found. And I'll give you my opinion on these treatments. So welcome to the show. I'm here each and every week right here with you, speaking to you live. Isn't it wonderful how we can just do this live all the time? So I'm pretty excited about that. So I'm trying to get this. I've got some research that I pulled up already, and I want to make sure that I am able to, let's see, ACell treatments. Okay, I want to make sure, because I did a lot of research on some of this. I think that it's really crucial that we understand more about ACell treatments. I think it's important that we understand more about hair implants. I think it's just so much that we want to talk about, we want to know, but we just don't seem to have the answers. And we're trying to make our decisions based on just things, make our decisions based on things we think it might be. So I'm going to pull up this information and talk to you a little bit more about it. So today on the show, I want you to tune in. I want you to listen up, and I want you to email me if you have any questions, and I want you to chat with me. My chat room is open. I should have some chats in a second. My email box is opening a whole bunch of stuff. I don't think it's my email box. I think it's me that I have not asked to open. But anyways, I'm going to, we're going to have a great show today, because I think anytime we can talk about hair loss, and I think that was one of the things that we ended on the show last week, talking about hair loss, because it's of epidemic proportions, and I have patients who believe their hair is shedding when the hair is in fact breaking. Why would my hair break? Why would my hair shed excessively? What's the difference? All of those things have to do with the foundational education, not just information, not be informed, but come to know it. So education is something you're going to come to know. You're going to be stronger because of it. You're going to be smarter because of it. So you're going to be empowered because of education. So we have some foundational things that we need to kind of explain and talk to you guys about. So that's why it's so, so crucial for you to understand more about this thing called hair loss. Because so often you have individuals who are saying that I'm losing hair, but they don't know why. And those things are really, really important. When you're losing hair, you need to understand whether this is coming from a strand level, excuse me, on a strand level, or if it's coming from something that's within the follicle itself. So we really, really, really want to kind of talk about that. And that's something that most people just kind of get confused on. So we want to do that today. And yes, nope, I mean this. Okay, so we're going to talk about that today. And then we want to talk about all these different treatments out there, because you know there are a lot of them. And I mentioned to you the PRP treatment, the ACell treatment, and then hair implants, because so many people want to know more about transplant or implant. They want, the name varies and it's always varying. But anyways, let's see if I can get my computer to settle itself down. But it varies depending on who you're speaking to, what practitioner, or even the research that you're looking at, because sometimes there's information about these particular treatments, and then you go to a different research website, and then it's like a whole different ballgame there. So we want to make sure that we try to get the correct information. And I'm also going to go in my email box, because I think that it's real crucial that we go into the email box and kind of talk a little bit about what's actually happening in our email box as well. Because this question may put my, there we go. All right, so we've got to say hello to everyone. So this particular question that I'm going to talk about today did come from, or these topics, ACell and hair transplants and PRP treatments, hair loss in general. This actually came from my email box. So I'm just going to say a quick, blow you guys a quick kiss. Generally, when I put my emojis up here, it's like I can't get rid of them. I don't know what that's about. So let's see if I can, let's enter. Oops. Okay. I am so not good at this these days. What is up with that? Because I get my emojis up, and then I can't put the whole little emoji thing back down. So you would think that I could, but I can't. But anyways, for those of you who are just tuning in for the very first time, I'm trichologist Lisa Akbari. I'm your hair doctor, and I'm here. I do want to say something too. I'm here each and every week, but I want to say something because I think it's really, really crucial that we understand what's happening here. We are out here. I am every week. I'm out here trying to give information out to you. And I feel it's a blessing for me to do that. But I also think it's really a blessing for you guys to, let's see, here we go. Hopefully that'll chat in there. I feel like it's a blessing for you to listen and tune in and ask your questions. So I thank you for that. And when we start talking about things that are very important to you and dear to you, you're blessed. But I'm also blessed because I'm able to use what God has given me to bless you. Okay, so now that we're through with that, there are many doctors and medical doctors, trichologists, who have opinions about hair implants. They have opinions about the PRP treatments, ACell treatments, or hair transplants, hair loss in general. And so I really want to touch on that today. But first, before I do, you guys know what I have not done. If you look and see my sunglasses still on my forehead, on my head, and those of you who are just tuning in, or who are listening from the radio, you can't see it, but I have my sunglasses on. So such a beautiful day today. So I'm in my studio now, but I'm going to take my ponytail holder off. And I'm not going to do anything special. You know, I always have my same little trusty ponytail holder. And I'm just going to make an afro puff. Let me put this back on. So if you had your ponytail holder on in that morning, and you know what? I think some of my little white friends are showing on my hairline. Ooh, okay. And I'm just going to kind of take my fingers and take my hair and just kind of, what I'm doing is I'm grabbing it and kind of grabbing it. And so that way I can keep my puff in the top of my head. And I can have, excuse me, a nice shrunken afro puff. And sometimes you just want that. Want that hair up and out of the way. And this is one of the things that I do. It's really, really easy peasy. And to stretch out your hair to get that little afro puff. And that's what you see me with today. And again, I'm just going to pat it down. You remember that folks that lived back in the 70s, they used to pack their fro down. You remember how they were? Okay. Now, might be a little crooked. I generally have to look at my regular page to see if it's crooked or not. I know, guys, you're ready for me to talk about hair loss because you guys are really tuning in, and I really appreciate that. Okay, so let's see if it's crooked a little bit. I think we're good. All right. So let's start with what are our foundational things. One of the things that she was, let me just read this letter from one of our viewer. She said, I'm hoping you are able to help me. I've been struggling with hair thinning for the past several years and have been to just about every type of doctor. Most doctors, including my endocrinologist, and you know, I'm always recommending endocrinologists, they say I don't have a thyroid problem. Well, that's great. Thumbs up for that. Praise the Lord. However, a identical, excuse me, hormone doctor said, doctors prescribed me thyroid medication. So her hormone doctor prescribed thyroid medication to treat the symptoms I was having. I just stopped the medication because I didn't feel that it was helping and may have made the situation worse. I took thyroid meds for approximately 3 years. That was going to be one of my questions. And she said, also, I have very thin strands. They become thinner over time. My hairdresser says the hair is not damaged, but stops growing. So your hairdresser said stop growing, but it's not damaged. Interesting. It usually comes out by the bulb. Okay, and if you, those of you who are not familiar with the bulb, I always tell you guys to look for that little club-like tissue to see if that bulb is there. That lets you know it's coming from the inside of the follicle and it's not just breaking off. Now, she goes on to say, last December, I went to a hair, well, she's got a whole bunch of stuff here, but I guess she went to a hair specialist of some sort. And she said, I went to a hair transplant PRP treatment doctor. Oh, okay. Who performed a biopsy and concluded that I had androgenetic alopecia. And those of you who don't know, androgenetic alopecia is a internal follicular problem where you lose the follicle, you lose hair because the follicle begins to malfunction, and primarily because of hormonal imbalances. So over here, her hormone doctor prescribed thyroid medicine, and her endocrinologist said she didn't have any problems with her thyroid, and she feels the hair she's getting out is coming out with the hair bulb on it. And now she's at this doctor who is a transplant PRP treatment doctor. And they said that she has androgenetic alopecia. Now, she went on to say she's tried minoxidil, and minoxidil is supposed to help stimulate the follicle and help the hair to grow. And PRP plus ACell treatments. Something was making my hair grow in some areas. I only had one PRP treatment, but haven't gone back, even though I was told I needed to, because the treatments are so costly. So that was the reason she didn't go back, even though she was told she needed them, but they were really costly. I stopped the minoxidil. She stopped the minoxidil. Okay, she stopped the minoxidil because I didn't like the side effects. She said, I also use Hair Max laser comb, and that's just, it's kind of a high, it's really a low frequency. that's supposed to stimulate interfollicular activity. It's light therapy. And that's what that laser comb is. I don't think it really does much. The FDA has approved this particular tool to be used at home, but it's I think the frequency is low, and so low that it has very little effect. Now, that's my opinion because I did test that when it came out many years ago. My hair is still very thin all over. I don't have patches of hair loss except on the temple, but it is exceptionally thin even in the back. I also was diagnosed with seborrheic dermatitis previously, seborrheic dermatitis. Some people, it's like tomatoes. Some people call it seborrhea. Some people call it seborrheic dermatitis. And that's basically the inflammation or within the sebaceous glands or your oil glands. It's that gland that's kind of attached right to the side of the follicle. And it gives us that natural oil that's supposed to secrete from our follicle as our hair grows out. Well, she said that gland, her doctor said that gland is inflamed, so seborrheic dermatitis. So she was diagnosed with that previously. Can you tell me what her options are aside from minoxidil and returning to an endocrinologist, dermatologist? Don't help. That neither one of them help her, is what she believes. Is the short hair syndrome product line useful for androgenetic alopecia? Thank you for your time. I look forward to hearing from you. And I'm going to send this to Kathy, and I'm going to give my response. I'm going to make sure Kathy has like what we call a snag it. So she will have my response to this email because she definitely wants to know more about this. So if we get all of our technology working right, then Kathy will have my response. Okay, so it looks like, I don't think so. Okay, so yeah, here we come. Praise the Lord. Okay, so Kathy, I am going to give you information on the things that you mentioned in your letter. So the first thing we want to do is take a look at, and here I am, we're live right on my talk show. And for those of you who are just tuning in for the very first time, I'm doing something a little bit different. You know, we're going to be talking about hair transplant. We're talking about PRP treatments. We're going to talk about ACell treatments. We're going to talk about the foundational things that you need to know before you start looking at and thinking about hair loss and whether or not this is what you're suffering from. So we're going to put that all into one. So let's just kind of go to, let's see where we are. And you'll see me here at Kathy. And what we'll do is let's go to our ACell. Let's see if we can, okay. Here we go. All right, so what is an ACell? Now, the FDA did approve this, and so that's why we're finding that it's being used now. But the ACell was approved by FDA. It's a cellular, this is what it's supposed to do, a cellular regeneration product. And now it's used in other ways. It's used in wound healing and has recently been found combined with a patient's own stem cells, and it's shown to help improve hair regrowth. Now, I don't want to say this is cloning or whatever, but it's supposed to stimulate the cellular process, like regenerate. So, and it's supposed to help with hair regrowth for both men and women. Now, in hair restoration, ACell is combined with that PRP treatment that we talked about, which is a platelet-rich plasma, and it's injected into the area. So into the scalp, into the area where we've lost hair, or we are losing hair, or where we have density inconsistencies. So we want to make sure that we understand that. Now, what is it that we need to know about the ACell. It is approved by FDA, it's FDA approval, and the PRP treatments. Now, the ACell treatment plus the PRP injections for hair loss is used a lot in hair restoration, because what we're wanting to do, that's what the surgeon is wanting to do, is they're wanting to give you this therapy in order to help with and try to prevent the hair restoration, actually transplant. So with ACell plus PRP injection therapy, it works to preserve and thicken hair in patients. That's what they're trying to determine. The hair that's there, they want to preserve that. That's within the follicle. Now, this is an internal follicular issue. This is not something that is going to be smeared on your hand and put on your hair ends and work. This is something that's supposed to help the follicle in its developmental stage, whether it's having some issues with developing or whether or not it's having some problems as it tries to develop to be a full and true texture. So that's what the thickening deals with, the texture, and preserve it deals with the integrity of what the strand is in terms of its full layers and strong and hydrated as it actually emerged. And this is supposed to do this in patients who are genetically predisposed to certain types of hair loss. Now, it's a non-surgical procedure, and it is a solution, and they inject the ACell plus the PRP into the scalp. And it's like a 90-minute visit. There's limited downtime, and it's supposed to be not like other prescription medications or topical applications, and it must be used as a part of an ongoing daily routine. So if you do one, it's not going to work well. So ACell plus the PRP therapy does not require, it says that it's not unlike the topical application, it's a daily routine. If you do that, it's not going to require you to do anything at home, but it's going to require you to allow them to have, you're going to have to have them, the actual clinic who's performing it. You have to go back to them for several treatments. Now, most hair loss is generally hereditary according to the research that we find. Now, what I found is that there are two categories of hair loss. Hair loss can be directly genetically linked, or it could be indirectly genetically linked. In other words, you can have signals that from your genetic, like your follicles can be genetically programmed to malfunction, gradually slow down, start that miniaturization process where the hairs get finer and thinner, and those hairs eventually will actually break away, or I'll say break away, but that was incorrect. The hairs will eventually stop producing within the follicle. So you will lose the ability, your follicle will lose the ability to actually produce a hair. Okay, so this non-surgical procedure of restoration is supposed to help and turn this around. Okay, so I'm going to do this. Let's make sure. Okay, and I'll just send the link on that. Okay, so now you have this follicle. So when we look, let's kind of look at what's happening here. You have this follicle that is lying in a dormant stage. In other words, the follicle is just not functioning as it should. The stem cells, the treatment that targets those specific follicles with the proteins, they're called growth factors or growth cells. Now, the PRP and the ACells, these things, let me just say, they said now the PRP is extracellular matrix. the ACell and adipose derived stem cells. Now, what they're really saying here is that within this particular process, now what they're trying to do is they have this non-surgical hair restoration therapies. They can stop hair loss, improve hair growth, and stimulating dormant follicle stem cells with target specific proteins called growth factors. And that's basically what they're doing. Now let's talk about what PRP is. PRP, it stands for platelet-rich plasma. It's a concentrated derived from your own blood, a rich source of specialized proteins called growth factors that stimulates stem cell activities in dormant hair follicles for up to 3 to 4 months. So it's that inner follicular stimulation, not rub it on the top, just be clear, but it's an inner follicular, it stimulates that inner follicular activity. Okay, now what is the ACell? The ACell matrix stem technology, it's been FDA approved medical device, which at the cellular level, it's supposed to repair, remodel damaged tissue. An ACell has a broad range of medical and surgical applications and is a naturally occurring protein complex. And it's formed in skin and other tissues. Now, when this is injected into the scalp, the ACell activates dormant follicles, and that's basically what happens. And this can, again, this is a form of stimulating these follicles, these dormant follicle stem cells is basically what the ACell does, and it can do it up to 18 to 24 months. ACell is not FDA approved. It's not. Now, the PRP is FDA approved. It says an FDA approved medical device, but note, ACell is not an FDA approved treatment for hair loss. See, what we will have to keep in mind is even though the device, the medical device is approved, it's not necessarily saying the FDA doesn't say this is a form of treatment that you can use for hair loss. Interesting. Interesting. Now, so these are things that you need to think about. It's an early intervention, but eventually, in many cases, when the follicle is genetically programmed to malfunction at a growth cycle, you can use these treatments. You can have treatments like the PRP. You can have treatments like the ACell. But keep in mind, this is not going to be treatments that are always going to work for you. Also, we need to be clear that this is what you need. And I think that's the biggest problem with a lot of folks. They are not aware of what they fully need. Now, how do we know this? Because we've got to decide if we want to do the PRP treatments, or do we want to do the ACell treatments? Should we take minoxidil or put minoxidil on the scalp, or should we have transplants, or what should we do? If you have hair loss, in other words, the hairs per square inch are decreasing in numbers. Another way to put it, you look in the mirror, you part your hair, you notice that you have a Christmas tree part, or you notice there's a circular hole somewhere, then that's alopecia. Somewhere here on the front hairline, somewhere in the crown, it could be in the back of the head, it can be anywhere on your scalp. If you notice that, then that's a form of alopecia. Now, you've got to understand, and this is what I try and tell all of my viewers and my patients, you have to understand there are two categories of hair loss. If you do not get that, then you're going to go down one street looking for an answer. It's not going to be there. You have to make sure that you know the categories of hair loss that you're suffering from. Now, what are those 2 categories? You've heard me talk about it before if you ever tuned into one of my shows on hair loss. There's 2 categories. There's external. I keep it simple, keep it straight, keep it so the average lay person can understand it, because, you know, we get into all of these words and all this, you know, and you don't get it. But I want you to get it. There are 2 categories. 1, internal follicular loss, and 2, external follicular loss. What is internal follicular loss? When you have internal, the follicle inside the dermis, the portion of the follicle inside the dermis, where the manufacturing plant, the only true live portion of that follicle, when it's internal follicular loss, the follicle is malfunctioning internally. How will you know that? If you have the proper examinations, then you are going to see, I'll tell you about that in a minute. You're going to see your trichologist will see villus hairs and things of that sort. But we're going to talk about that in a minute. Now, if you have internal malfunctioning in the follicle, your hair may stop growing. The follicle may start a miniaturization process. Your follicle, you may not feel any scalp symptoms, any hair symptoms, other than you notice that your hairs per square inch are decreasing in numbers. It's strongly genetically linked. It's a lot of these treatments that we've talked about this morning will stimulate. Now that's internal. External follicular loss is where your follicle internally is functioning. You still see the hairs per square inch decreasing in numbers. All those same things are happening. The difference, the telltale sign, is an itchy scalp, flaky scalp, tender scalp. If you don't have itchy, flaky, tender, then one or all, most likely it's not going to be external. It'll be more internal. Now that's just what you may feel, and that's just one way to know. What is really happening, your hair grows to the top of your scalp. Let's say this is the inside of your scalp, your follicle. Your hair grows all the way up to that lip and it can't get out. There's a blockage there. So you may have blockages along the mouth of the follicle or the mouth of the follicular unit. Mouth of the follicle, you'll block one hair. Mouth of the follicular unit, you're going to block several follicles, which hold one hair each, and so you'll block several hairs. Now, how do you know which one you have? You make an appointment with a trichologist. A trichologist, one that uses a handheld microscope, and that trichologist will help you to understand what category are you suffering from. Now, what will the trichologist find? With internal follicular loss, there may not be any symptoms, but what she's going to use, or they're going to use a handheld microscope and view the scalp microscopically, starting maybe with a 30x and move all the way up to 200 and sometimes 400x. So they're blowing that up, that percentage, so that we can see exactly what's on your scalp, what's happening in the mouth of the follicle, what's happening with those follicular units. Now, what is a follicular unit? A follicular unit is what I call the macropore of the two pores. There's a follicle and this follicular unit. The follicular unit is the macropore. It holds several follicles, as I said earlier. What are the follicles? They're the micropores. There's a smaller one. Now, each unit can hold, and it's strongly genetically linked, it can hold 1, 2, 3, 4, or 5 follicles. Sometimes and most don't hold 1 unless you're on the hairline, but generally in the body of the head is 3 or more. It's strongly genetically linked. What we look for when you are examining the follicular unit and the follicle, you're looking for that follicle, the trichologist is, and they're determining whether or not your hair is emerging. If it's emerging in internal follicular loss, if it's genetics, drug-induced like medication, hormonal, whatever it is, if it's internal, we're going to read a villus type hair. That's a hair that, or transition hair. Villus hair is a hair that emerges from the scalp, but is lacking color, lacking length, and lacking texture. That means you have a very thin strand that's albino, and it's really short. That tells us that the follicle is malfunctioning internally, because here, that is not characteristic to your surrounding hairs. So that's how the trichologist can tell you one guaranteed way that something is going on with that follicle. Sometimes it's just something simple. Now you're taking supplements and it corrects itself. And sometimes it's more serious. At that point, the trichologist will recommend an endocrinologist to do autoimmune disease workup. That means you want to see if there's thyroidism, there's all other problems within the body systems and the endocrine system. Also, they can do the hormonal test, which is a part of it. So they will be able to tell you, the endocrinologist is the one to go to, but you have to have those specific tests. There's a book that Dr. Redman out of New York, he's an endocrinologist, wrote called It's Your Hormones. Locally, I recommend a endocrinologist. Her name is Dr. Beverly Williams Cleaves. Super, super smart lady. So there are endocrinologists out there that are focused on this particular type of hair loss. Some are not, because endocrinologists, come on, they cover a lot of things. So they may or may not be focused on that. So keep that in mind, guys, okay? Now, the other thing you have to take a look at is the external. How do we know if it's external? The trichologist will use a handheld microscope, several levels of magnification, and they'll look for blockages. We have these blockages in many cases with a hair loss that's external, that will be along the mouth of the follicle or within the complete. That blockage will prevent that hair from emerging. Now, there are factors, determining factors. If that hair is large enough and the blockage is thin enough, that hair will push right through it. We'll see it push that blockage right out with it. If, depending on how dense the actual pollutants are, we're going to talk about what that blockage is, and the texture or size of the strand, that will be the determining factor. If you have a dense pollutants, then you're not going to get, the hair is not going to emerge. We'll see that hair, or we'll see that defined plug or blockage. You have to have the examination. Stop guessing at it, guys. Now, what are these things that are on our scalp? Over the years' period of time, we will have hair products that aren't clean. We use like conditioning shampoos. I know we love them because they detangle, but no, they don't clean. We use other products that are not clean, that are waxy, that don't break down well in water. They just don't do well. They're not clean. Then we have dead skin cells, like in scalp pollutants. Your scalp sheds daily, so you have to clean. You have to clean every 3 to 7 days, because after 3 days, you get a buildup. By 7 days, your scalp is filthy. It's very challenging for women with dry hair or kinky natural hair, because we feel like it's just going to dry us out. Well, you have to look for a clarifier with the pH 4.5 to 5.5. We always talk about that. Email me, I can help you out. So, but you have to clean, so you can keep those pollutants from solidifying. So the next thing, next is 3 of those. 3 in that category of pollutants. There's environmental. Dust, dirt, debris will begin to collect in your hair, work its way to your scalp, and it's trapped. So now you have hair products that are unclean. You have dead skin cells because you haven't shampooed like you should. And then you have environmental pollutants, dust, dirt, and debris. So what happens? It solidifies. You know, have you ever seen a wax floor and they want to get that build up so that you can protect the floor? Well, that's not what you want on your scalp. There's a positive buildup and a negative buildup. On your scalp, if you allow dust, dirt, debris to solidify, it will create a wax, and it will create a blockage along your follicle. It also creates itchy scalp, flaky scalp, tender scalp as the follicle dilates. So be careful, okay? If you're just tuning in for the very first time, I'm trichologist Lisa Akbari, your hair doctor. I am so happy to have you guys here today. Welcome to the show. Welcome, welcome, welcome. We're here talking about hair loss, and we've talked about PRI treatments. We've talked about, oh my goodness, we've talked about various things like ACell, and now we're talking about the difference in the two categories of hair loss. I want to talk to you a little bit about biopsy, what they do with the biopsy, hair transplant. We're going to try to get all that in before we tune out today. And I think we've already talked about minoxidil, but we can touch on that again. That laser comb, that hair max that people, this is all in the email that I'm speaking from today. And I'm pretty excited about that. Let me just see if I have any chats on my chat room. Yes, let's see. You know, guys, I am so sorry. You guys got to bear with me because I am in this situation again where I can't seem to get my, let's see if I can do that. Say something. I said something. I can't seem to get my little chat box to, I know that you guys have tuned in. I can see you. I love you. Thank you. Thank you for that. I'm trying to get my chat box to clear up and get my, yeah. I see that I've been saying a lot. So you guys, my chat room is open. I've sent you guys 5 kisses. And so now if you have a question for me, please ask that question. You can also email me, Lisa at lisaakbari.com, and that's Lisa at lisaakbari.com. I'll blow you more kisses here. And you can call my institute at 901-380-4445. That's 901-380-4445. Okay, let's get back to the show. And let's talk about, and I'm here every week, guys, for you. But my email address, I didn't give that, I don't think. Let's do that. It's Lisa at lisaakbari.com. That's Lisa at lisaakbari.com. Okay, and I'm wearing my little fro today, as you guys who are online can see. Okay, so let's get back to our topic, and we were talking about hair loss. So let's see if we can get our question back up, and let's see, there we go. All right, oopsie, I don't want that. Here we go. Let's resume. Okay, very good. All right, so now what do we want to talk about? We've talked about those particular things. PRP, we've talked about the internal and external follicular loss. Let's talk about biopsies. What are they going to do with the biopsy? Now, how is that going to help you with hair loss? Because in many cases, there are fungal problems that could cause inflammation that could eventually lead to something called cicatricial, which is inflamed cells, inflammatory cells around your actual follicle, where the hair actually is produced within the internal portion of the follicle. So the biopsy helps with that. And also it also helps to see if we've got a functioning follicle there, if there's a follicle there at all, or if it's just scar tissue. So it's really helpful when you have some of those chronic problems. Your endocrinologist, not endocrinologist, but your trichologist may send you to that particular practitioner. And by the way, your trichologist is really the first step, because they're going to determine whether or not, if they use a handheld microscope, if they just stand across the room and say, okay, you have this or that, then no. We can give educated guess, but I don't believe in that, because, you know, people are suffering enough on their own. They do not need you guessing at their problems. So I always tell patients to start with a trichologist, so that one that uses a handheld microscope so they can give them the direction. So if it's internal, there are going to be signs of it. If it's something that looks like it may be a scalp disease, they can't diagnose it, but they can send you to a dermatologist. Internal, if they're villus hairs, they can send you to a endocrinologist. So you have guidance. If it's not, if it's external, where there's blockages there, they can treat that. And so it's just really important. Now, what is another option? I have patients who I get ready all the time for hair implants or transplants. What are hair transplants? Hair transplants or implants, it's where your area, like if you have hairline thinning or if you have crown thinning or whatever you have, that particular area, you're looking to put hair in that area. Now, whose hair are you using? Your own. So there's always a section, and this is performed by a surgical dermatologist, a surgeon, a specialist in this field, hair replacement. They will look for a donor space. Sometimes it's in the back of the head, sometimes it's on the sides, wherever you're the most dense. In other words, the hairs per square inch are large numbers. They're going to move that hair, and they're going to take them out, and then their assistant is just going to slice it and separate those follicles from that unit. Now, they're going to implant them, transplant them into that area. And once they do, that follicle, and some ask, will it hurt? They will give you enough to relax you. They will give you medications you won't feel it. Some people are shown on some of these videos, reading a magazine, eating lunch. I don't know if that's totally, you're that comfortable, but many have reported that you are. The main thing is you're not supposed to feel it much, but what happens, it is something that is done in a one-day procedure. Now, the other question people have is, will it, not only will it hurt, but will that follicle survive? You moved it from back here and up here, is it going to grow? Now, the first thing that happens, you got to keep in mind that it takes on all the characteristics of that follicle. So in other words, if that follicle was in a shedding mode, you're going to lose that hair. It's going to shed off, and then it's going to start to regrow that new hair from that follicle, because what's important is what the follicle piece, not the hair piece, because the follicle can make new hairs. The growth process is to grow hair, shed hair, and keep starting it over and over. So you have those stages of anagen, which is growth, telogen, which is shedding, and then catagen, which is that short resting period. Okay, through the transition. So you're going to have a new hair. So if it sheds off first, then no worries, it's going to grow back. So it will take on the same characteristics that it had in the back of the head. So you won't have to worry about it going into an area where it's going to start doing what the area was doing prior to putting the hair there. And do I recommend it? That's another question. Yes, absolutely. I think it's safe. I think that you need to look at several things before doing this. One, you need to make a commitment. Make a commitment to several things. The finance, because it's going to cost a little bit, but it's good. I always tell everyone, don't buy a new car this year. Or, matter of fact, just don't go to the movies for a year. I mean, it's really not that expensive in the scheme of things. For me, if I had some issues, pray I never do, I am definitely going to have implants. I am not going to go bald if I have an opportunity to have transplants or implants. So do I recommend it? Highly, but you need to be sure. So you have to go through the trichologist, and then from there, let the trichologist partner. So it's going to cost. Would I recommend it? Yes. Now, the other thing you have to do is you have to get the pre-care. You need to see a trichologist so they can take a look at your scalp and say, okay, your scalp is healthy enough, your epidermis, so that when that implant is done, you don't have a horrible post-care. So that's important. So you've got to make sure that you have a trichologist view your scalp. If the scalp is not healthy, get on a healthy scalp care natural. You can do a natural plan with a trichologist. If they believe that there may be some scalp disease developing, then you want to have them recommend the dermatologist. So you have to know that it's going to cost. Yes, I recommend it. And know that you have to have the pre-care by having that examination from a trichologist. Then from there, the actual treatment is done, and know that you have to get them all at one time. If they recommend you wait and get several grafts, is what it's called, then you do what they say and then come back for the others. Now, post-care. Post-care is a problem for two reasons. Now, I think they've improved in a lot of these offices where they don't have you remove the stitches. I don't recommend you remove your own stitches. I recommend that you have someone remove them for you. I think that they've improved in some of these offices where they use the ones that will dissolve, which is, hello, why didn't we do that at first? But yes, so that's my take on transplants. You also need to make sure you get the post-care. Go back to your trichologist, do hair and scalp treatments. You don't do any color or any chemicals. They're already going to tell you that, but make sure you do have a clean, acidic, stimulated, hydrated environment. So the skin, because it is a surgical procedure, so that skin will stay in that environment where you won't add with all the debris, pathogen, disease-causing bacteria developing and all that debris from not having a clean scalp. Now, that's my take on it. Minoxidil. Will minoxidil do some things? And usually they will recommend minoxidil along with it, but minoxidil is a treatment for alopecia. Upjohn approved this Upjohn developed it. The FDA approved it many years ago. It's been put in a lot of them, Rogaine and some of the others, but minoxidil basically stimulates inner follicular activity, and it helps that hair to follicle to function better, but it does not give that long hair. I haven't seen that. I've seen it give the fuzz, the shorter hairs. Some of it is a little better in texture, so they can be medium in size. You can even get some skin color, so those pigments are there, but it doesn't really get any length. Now, the other piece is once you stop using it, generally that hair falls away. So it's something you would have to do all the time, ongoing. Now, the other piece is the Hair Max laser comb. I was immediately terrified when this was approved by the FDA years ago. But when I ordered one, because I had to see what this thing does, the intensity and frequency is so low that it can't harm. But it's so low that I'm wondering if it helps. So that's something you need to think about. What does it do? It's just light therapy. And as you put it on your over your scalp, and you have so many times a day or a week to do this. I think it should be recommended or not recommended, but I think that you need to see a trichologist or a dermatologist before purchasing this. It's not super expensive, but I know it's got to be over $100. Maybe now they're cheaper. So those are the things we have. I'm hoping this helped you, Kathy. We spent the show on because I think it's important. Please email me if you guys have additional questions. Lisa@lisaakbari.com. Okay, now, so let's see where we are with the rest of the show. If you're just tuning in for the very first time, I'm trichologist Lisa Akbari, your hair doctor, and today we're here talking about hair loss. We're talking about, and whatever you like to talk about as it relates to your hair. My phone lines are open. No, my chat room is open. Let's get that straight, Lisa. And I'm going to start opening some phone lines pretty soon. What do you guys think? Give me some feedback on that if you guys want me to open my phone lines, and we can do that. I'm in my email box today. We're talking about hair loss. We're talking about ACell, PRP treatments, hair transplant. If you're just tuning in, make sure you go back. This show, all my shows are archived, so I do generally do that. I've got my little puffy fro today, and I'm trying to do a Sri Lankan fro, but my hair is so long, it's really hard to do them. But if you're going to do those, you kind of have to pat them down. But if you're tuning in on the radio and you can't see me, make sure you go and subscribe to my YouTube page. My YouTube page is Lisa Akbari, and it's on YouTube, and you can get in and subscribe, and you'll get an alert every time. And I think you have to have a Google account. I'm going to have to make sure, because it looks like my fro is crooked. Okay, so here we go. Yeah. Okay, here we go. Now let's get that straight. Because like I said, you remember a year back in the day when you used to pat down your fro? I think that might be a little bit better. You would have to literally pat it down. And we did that because our hair would be longer than our fro, and we wanted to make sure our fro was even. Okay. This just might not get even today. All right, so we only have a few minutes left. And in the time that we have left, I want to see if I can get some questions in. And I also want to get in my email box because, guys, we really have, you said, oh, hi, Bernice. Hello, hello. So you guys are saying hi to me. Thank you so much. I wonder if you guys were out there. I have someone as a comment, and it's Juliet. She said, thanks for the hair intro. My hair is very strong, coarse, and thick. What can I do to soften it up a bit? There's a couple of things you can do, Juliet. You can, number one, you can make sure that you hydrate your hair daily. So often we don't do that. And you've got to step it up a notch when you have coarse and dehydrated hair. So what I mean by that is you have to layer your moisturizers in. First, you want to use a wet moisturizer. You have to use a spray-on hair vitamin is what I'm going to recommend. Then you have to use a hydration, which is the second product I'm going to recommend. And then you have to use Moisture Plus. And then you have to seal it. Now, will I have to do that every day? You got to see how dry the hair is. I would say do that when you shampoo. And then each day, maybe use the vitamin and say the Moisture Plus. But if you find that it's still dry over a period of time, for a period of time, you may have to use those every day. The other piece that gives you the most balance is making sure that you are deep conditioning, and make sure you're shampooing. So you got to do those things as well. Now we have another question. Is from I don't want to pronounce the name incorrectly, but her last name is Gray, so we'll say Miss Gray. She said Argan Rain products really helped her hair. So she said, seeing the results, it's taken 2 months. But see, this is the thing that I have to get you guys to understand. When it comes to hair products, I believe that if it ain't broke, don't try to fix it. So I don't recommend my products unless you need my help. That's the only reason I even make products. Okay, someone said happy anniversary. Yes, I did just have an anniversary. They said, what a blessing, such a beautiful and inspiration couple. Well, thank you, my love. I did. I've been married a long time. I love my husband. Another person said happy anniversary. Thank you for that as well. And let's see, someone else said, she said, the question said texture change, about managing my own hair. And she bentonate clay. Okay, she said how Lisa manages her. Oh, those are these are comments. I guess we have a comment in here somewhere. And she was talking. She's got some of the things that I have on some of my videos here. But let's see. Yeah, so she just kind of went through to put the times on them. And I used to have a assistant that would go into my videos, and if you had a question, she would find that time and she would put it right beside that video, which was so helpful. But I don't have that person right now as a student. So I've got to get me a student back in here that can stop and do that. Most of my staff is busy with other stuff and they're not doing that. But a personal assistant, that may be what I need. I think so. What do y'all think? Okay, so Bernice comments, she says, so what do you think about leave-in oil and cream? I think we talked about that last time, but I will say it again. I don't think you should do oils first. I think you should use a moisturizer and always seal with oil, moisturizer, then oil, because moisture is going to raise your moisture levels, and then oil is going to seal in that hydration. So I think it's very, very, very important. Okay. She said, this is another question. She said, can you tell me why and what to do? My scalp hurts all the time and my hair is not growing. Okay, this is what you got to keep in mind. If your scalp hurts all the time, pain receptors are responding to something that's going on. Your epidermis, your top skin, you can feel the sensation, but there are no blood vessels in that area. There's no way that you can injure your epidermis, but there's no way that if you're feeling pain receptors, you're feeling hurting like you're describing it, then you're probably close to the basal, or it may even be in the dermis. So you need to see a trichologist, because you may have something serious and they can recommend a dermatologist. But in the interim, in the meantime, you can actually start. We have a scalp program. You can go on my website, lisaakbari.com. Let me see if I can put that in here so we can. Okay, someone has a question about minoxidil, but let me put my email address in here. Lisa. Okay, guys, let's see if I can get this. There we go. I'm going to put my email. It's Lisa. So LISA at, let's see if we can shift that. Ooh, you know, technology, love it, love it, love it. But I tell you guys, see if I can do it this way. You know how much I do not like. At lisaakbari.com. That's Lisa at lisaakbari.com. So now, okay, I'm back up here. So that's where I like it. Now you'll be able to go to my website, and there's a scalp program that I highly recommend. Now, someone asked, what did you say about minoxidil? Minoxidil, like I said, it was approved. Upjohn developed this product, and it was approved by the FDA, and it helps to stimulate hair growth. Minoxidil can allow the hair follicle to function, or in some cases, not all cases, because it has to be an internal follicular hair loss issue first for it to even begin to function. Then you have to also make sure that you understand that it's only going to grow in a hair that's of a certain length, like it's going to be maybe a half an inch, if it gets considered long. But it won't grow any further than that in most cases. And it's going to have some color, but it won't be as thick as the rest of the hair in most cases. These are all things that I found to be true. You may find some other studies that are showing something very different. But when you stop using the minoxidil, then the hair generally will come back out. So that was one of the things that I said. Okay, guys, it's time to wrap it up. I love you guys. You guys are so great. I'm here each and every week, and I'm going to be coming to you each and every week, and we're going to have a great show every time. Keep the questions coming. Lisa at lisaakbari.com. I think I put my email address up there, correct? My website is lisaakbari.com. Let me put that up there as well. Let's do lisaakbari.com. BARI.com. So that's email LISA at lisaakbari.com. Web address is lisaakbari.com. So there's just a Lisa in front of it. So it's Lisa at lisaakbari.com. There we go. All right, guys. Love you so much. To God be the glory in Jesus. You know who I serve. Thank you so much for tuning in each and every week. And I will see you next week right here on Ask the Hair Doctor. Remember, if you want to come and see me and have a microscopic and physical examination, you can do so by calling 901-380-4445. You can also request a link to my fiber, or I say fiber, fiber cyber consultation, where you can see me like you see me now, and we'll do like this nice little Google Hangout. I'll show you how to do certain things to your hair. I feel like I just want to do that to my hair today. Certain things to your hair, and I will give you an opportunity to really just get all your questions in and have a little mini class. So some people are out of the country and they just can't get here. We have people that travel from all over the world, but some of you just can't do it. It makes no sense for you to do it. So if you need a cyber reading, let's do the cyber consultation or cyber reading with the hair strand reading. Let's do what you need to do. And if you can get to me, perfect, because then I can put your scalp under the microscope in addition to your hair. I love you guys. I'll see you next week. 901-380-4445. LISA at LISAAKBARI. Like me on Facebook. Like me on, subscribe. Yeah, like me on Facebook. Follow me on Twitter and subscribe to my YouTube page. I'm getting it. I'm getting there with the technology. Have a wonderful, blessed morning, evening, or afternoon, depending on whether you're listening to this as an archive or if you're listening to it live. Love you guys. See you next week. Bye now.